Most people don't realize this, but some of the medical checkups you've trusted for decades could actually put your life at risk after the age of 65. That's right, tests you believe are protecting you might be exposing you to unnecessary procedures, anxiety, and even life-threatening complications. In the next few moments, you'll discover 5 medical checkups that could do more harm than good in your later years, and why what you don't know about them could cost you everything. Here's a statistic that should stop you cold. Nearly 1 in 3 seniors undergoes at least one unnecessary medical test every year, and many of those tests lead to a dangerous chain reaction. More tests, more medications, more complications. It happens every single day. My name is Dr. Jake Miller. For over 20 years, I've treated patients who trusted the system, followed every recommendation, and still ended up worse off. And here's the truth nobody tells you. Not every test is designed with your best interest in mind, especially as you age. This is something most seniors will never hear from their own doctor. Let's start with the first checkup. Most people believe annual full-body scans are the ultimate safety net. That assumption is exactly what costs people their lives. Here's what's actually happening inside your body. These scans, often using CT technology, expose you to repeated doses of radiation. Over time, that radiation accumulates. Your cells don't forget it. They store the damage, and that damage can mutate into cancer. Here's the critical detail that separates this from necessary imaging. 1. These scans often detect harmless abnormalities that would never cause problems. 2. Those findings trigger invasive follow-ups like biopsies. 3. Each follow-up increases your risk of infection or complications. If you're getting full-body scans just to be safe, that's not prevention, that's exposure. That's a conversation you need to have with your doctor this week, not next month, this week. Now you know about full-body scans, but the next checkup is even more dangerous because it hides behind good intentions. Most people think routine prostate cancer screening with PSA tests should continue forever. That assumption is exactly what leads to overtreatment. Here's what's actually happening inside your body. As men age, prostate cells naturally change. PSA levels rise even without cancer. But the test doesn't distinguish between harmless growth and aggressive disease. Here's the critical detail. 1. Many detected prostate cancers in older men grow so slowly they will never cause harm. 2. Treatment often involves surgery or radiation. 3. Those treatments can lead to incontinence and sexual dysfunction. And 4. The stress of treatment can weaken the entire body. If you're over 65 and still getting PSA tests without a clear reason, that's not always protection. That's potential harm. That's a conversation you need to have with your doctor this week. That insight could change what happens at your next appointment. But the next one has a body count. Most people assume routine colonoscopies should continue indefinitely. That assumption is exactly what puts seniors in the emergency room. Here's what's actually happening inside your body. Colonoscopies require sedation and bowel preparation. For older adults, that preparation can lead to dehydration and electrolyte imbalance. And the procedure itself carries risks. Here's the critical detail. 1. The risk of colon perforation increases significantly with age. 2. Recovery from sedation becomes harder for aging brains. 3. Complications can lead to hospitalization. 4. Alternative screening methods may be safer. If you're continuing colonoscopies without evaluating your personal risk, that's not always necessary. That's a decision that needs immediate review with your doctor. Before we go further, I need you to understand one thing. More testing does not mean better care. In many cases, it means more opportunities for something to go wrong. Now let's talk about a checkup that millions of seniors trust without question. Most people believe annual cardiac stress tests are essential after 65. That assumption is exactly what leads to false alarms. Here's what's actually happening inside your body. Stress tests push your heart to its limits. That's the point. But in older adults, the results can be misleading. Here's the critical detail. 1. False positives are common in seniors. 2. Those results lead to invasive procedures like angiograms. 3. Those procedures carry risks like bleeding or stroke. 4. Many of these interventions don't actually improve long-term outcomes. If you're getting routine stress tests without symptoms, that's not always preventative care. That's unnecessary risk. That's a conversation you need to have this week. Hit subscribe right now if you're not already here, because what I'm about to share next is something most doctors won't say out loud. Stay with me through all 5 of these, especially number 5. That one has never once been on any list you've seen before. Now, the 5th checkup. Most people think routine bone density scans should continue every year after a certain age. That assumption is exactly what leads to overmedication. Here's what's actually happening inside your body. Bone density naturally decreases with age. That's biology. But frequent scanning can exaggerate the perception of risk. Here's the critical detail. 1. Small changes in bone density may not reflect real fracture risk. 2. Medications prescribed based on these scans can have serious side effects. 3. Those side effects include jaw problems and unusual fractures. 4. Not every decrease requires treatment. If you're getting frequent bone scans without a clear change in health status, that's not always helpful. That's something to review immediately with your doctor. Right now, as you watch this, there are people sitting in their living rooms believing more tests mean more safety. And while they're chasing reassurance, they're exposing themselves to unnecessary danger. This is happening inside people right now who are treating numbers instead of symptoms. While you were treating the wrong thing, these risks were quietly building. Let me say this clearly. I'm not telling you to avoid medical care. I'm telling you to be strategic, to be informed, to question whether each test is truly necessary for you. Because here's where it becomes life-threatening. When unnecessary tests lead to unnecessary treatments, and those treatments trigger complications your body can't handle the same way it used to. Every single time, every one of those patients had it. Everyone ignored it. The moment when they could have asked one simple question, do I really need this? Before you close this video, I need 60 more seconds of your attention. Early detection can save lives, but over-testing can destroy quality of life. And sometimes it does both at the same time. Here's what you need to do next. Write down every test you're currently getting, every single one. Then write down why you're getting it. If you don't know the reason, that's your first red flag. Call your doctor and read that list out loud. Ask specifically, do I still need this at my age? Ask what would happen if you didn't do it. Ask what the risks are now, not 10 years ago. You're not being difficult. You're being the only person in that room fighting for your life. Like this video if you've learned something new. Subscribe for more insights that could change everything. And share this with someone you care about, because they might be one test away from a decision they don't fully understand. And there's something I didn't tell you. There's a specific combination of just 3 common symptoms that most seniors ignore, and it's one of the earliest warning signs of a serious condition. I'll break that down in the next video.